Thank you.
Thank you very much, Joel, and good morning and welcome to all of you. Thank you for attending the Spring Representative Assembly. This RA marks the end of my year as President. It has been a busy year with lots of positive changes. It was Stephen Hawking that said, "Intelligence is the ability to adapt to change." Well, given the many changes the SMA has experienced this past year and will certainly continue to face in the future, I would say that this must confirm that we are a very smart organization indeed. Seriously though, speaking from personal recent experience, and to echo Adlai Stevenson, a past Illinois governor and UN ambassador, change is inevitable. Change for the better is a full-time job. I would like to review very briefly a number of improvements implemented by the board over the past year. First, the creation of a broad and ambitious 3-year strategic plan for the SMA. This plan signals to our members and our healthcare colleagues that health system transformation cannot happen without the active collaboration of Saskatchewan physicians. Until now, we have been on the sidelines for far too long and included in the conversations way too late. Our strategic plan aims to ensure that physicians play a pivotal role on the healthcare team and in health system redesign. We continue to seek ways in which to accomplish this goal, and I feel that many of our colleagues are leading things in the right direction through their involvement in key healthcare conversations. It is crucial to our members and ultimately our patients that we are present at provincial tables and proactive in these discussions. Who better than we physicians to advocate on behalf of our patients and their families? As physicians, we owe it to them to ensure that their voices are also heard. During my term as SMA President, I did my very best to make our collective voices heard where it matters. A second change that you're all aware of is the appointment of our new CEO, Bonnie Broussard, a well-respected Saskatchewan healthcare system CEO who is especially well-versed in quality improvement and health system transformation. We felt that Bonnie's particular skills align very well with the commitment of Saskatchewan physicians to continuous improvement and the delivery of compassionate, high-quality, patient-centered care. In the months to come, Bonnie's knowledge and expertise in this area can only accelerate our efforts. I have received numerous positive comments, both internally and externally, regarding Bonnie's leadership. This feedback affirms that the SMA has unequivocally hired the right person into the CEO position, given the organization's aspirations. Within the SMA, in 2015, our main focus will be on making the SMA higher functioning and better positioned to respond to our members' needs. The senior leadership team has been working on operational plans for the organization and determined this to be an area that needs immediate improvement. Tomorrow, the two Marks, Dr. Mark Brown and Mr. Mark Caesar, Economics Director, will explain the process used by the senior leadership team in this operational plan. When I look back over the past year, one of our key and organizational corporate achievements was the move to our new office building at 2174 Airport Drive, just up the street. The new building, which is co-owned by the SMA and the College of Physicians and Surgeons of Saskatchewan, through a numbered company, will enable our staff to serve our members' needs better in an improved working environment, and which offers, in addition, the ability to host several meetings at once, in person and virtually. We are very proud of this new building, and members who have visited us have expressed similar sentiments. I want to take this opportunity to thank the entire staff for their patience and cooperation during this transition. Anyone who has experienced a major move knows the stresses and challenges that arise. I can honestly say that I never experienced anything but the highest level of professionalism from the SMA staff during the weeks leading up to and following the move to the new building. I would specifically like to thank Laurie Dumba, who led the project for both the SMA and the college, in addition to fulfilling her duties as Change Management Advisor with the SMA's EMR program. Thank you very much, Laurie, for all your hard work. Looking more externally, a further positive change in which the SMA has played a significant role is the adoption by over 80% of the province's family physicians of electronic medical records. A handful of years ago, less than half of Saskatchewan physicians were using EMRs. Now this figure is 4 out of 5. And special thanks to Doug Dombrowski and his team for this achievement. Over the past year, the SMA has been the leading voice in the province when it comes to calling for collaborative care among healthcare providers. Last spring, this time, when the Executive Director of the Saskatchewan Regional Nurses Association made comments to the media that patients who saw a nurse practitioner would not go back to seeing a family physician, the SMA used this as an opportunity to forge closer connections among the professions. Together with the SRNA, the Saskatchewan chapter of Family Physicians of Canada, the College of Family Physicians and Surgeons, and agencies representing nurse practitioners in Saskatchewan, we are now in the process of developing a joint statement on true collaborative care. This statement is a first in Saskatchewan, as it will unite several healthcare providers and future mutual understanding between different professions. More importantly, it will unite all of us in our efforts to provide the best care for our patients by improving both access and patient outcomes. We are aiming to have the statement completed by the end of the summer. To sum up then, during my year as President, we have accomplished significant and promising changes that I believe are for the better. Some notable changes remain, however. First and foremost, the slow pace of fee-for-service negotiations has been a frustration to myself, the board, and you members alike. We have been patient with this complex process, but we fully share the desire of our colleagues to get a new deal signed soon. Medicine is a public service that must take into account economic and fiscal circumstances. While we must continue to negotiate for the best possible agreement for our members, we are also under an obligation to demonstrate to the people of Saskatchewan that physicians strive to be a part of the solution of making healthcare more efficient, safer, and more accessible. Briefly, where we stand at present is that in mid-April, the Ministry of Health provided us with their proposal, and we submitted a counter-proposal last week. Dr. Sridhar, who is leading our negotiation team, will give you greater detail in the MCRC session tomorrow morning. It is the SMA's wish to have this agreement signed very soon, so we are able to shift our focus to the several issues currently affecting physicians and patients, and to supporting them in navigating these changes that are facing them. This past year also saw increasing scopes of practice and proposed legislative changes for other health professionals, including naturopaths and pharmacists. While the SMA embraces the notion of highly effective team-based care, it was extremely frustrating to see these changes advanced and forced upon physicians with little or no consultation, or having our suggestions and recommendations totally ignored. Improving access to care is an ambition shared among all professions, but it must never supersede patient safety. Amendments to the Pharmacy Act and the bylaws of the Saskatchewan College of Pharmacists that will allow pharmacists to administer vaccines and order and interpret diagnostic tests are imminent. The SMA will continue to voice the significant concerns it has about the new scope of practice for pharmacists and the impact it may have on patients and safety. This is another case where I believe that the consultation with physicians was too little, too late, and ignored. Probably one of the biggest policy issues currently facing our profession is that of medically assisted dying. Although legality in this regard is still about 9 months out, the topic has assumed increasing relevance in the wake of the Supreme Court decision in February 2015 to strike down the ban on physician-assisted suicide or death. On a similar note, conscientious objection and a physician's right to refuse is an issue that has elicited strong opinions from physicians and the public, with the college receiving over 4,500 responses to their request for input. The SMA also received a significant number of responses to my President's letter outlining the Board of Directors' position on the proposed policy. There's no question that members hold strong opinions both for and against a physician's right to refuse. What is important to know is that physician-assisted death is at presently not part of this draft policy, as we currently do not know what the actual legislation change will be. Wisely, the Council of the College has decided to revisit the draft policy after completion of their broad consultation. The SMA continues to give voice to its members on this topic via the participation of Drs. Andoig and Brian Geller on this college committee. When I look to the future, it becomes increasingly clear that the medical profession is on the verge of a large generational turnover. The way we communicate with our younger colleagues and conduct the business of member-driven organizations like the SMA is already being impacted by this. Although I have only recently joined the Twitter sphere, and that as a lurker, I certainly appreciate and respect the power of social media. It's heartening to know that your incoming president, Dr. Brown, is a seasoned tweeter. We must continue to pass on our knowledge and values to the next generation while embracing their practice and communication preferences. It is also vitally important to provide the next generation of physicians with the tools they need to be leaders in their practices, their communities, and the province. As Dr. Chris Simpson, CMA President, said at a presentation recently at the University of Saskatchewan, the current students and residents are extremely motivated, involved, and engaged. They will ascend to leadership roles probably a decade earlier than the current generation of healthcare leaders. One of the key ways we can initiate positive change in the medical profession is to start to collaborate with our colleagues more often. We will hear several viewpoints on that subject here later today, and I hope we will be able to start conversations that bring about real change, leading to greater collaboration across specialties, generations, and regions of the province. In closing, I want to thank each of you for your support during my year as president and your commitment to the aspirations of the SMA and the time you've offered over the past year. It has been a pleasure serving as the president, and it is my hope that over the past year, the SMA has made a positive impact on the healthcare system, on the practices of medicine, and of course, on the health and well-being of both our members and of our patients. It is also my hope that this change will continue to evolve and improve healthcare in Saskatchewan. As the American politician Christopher Bond put it, change is tough. People don't like it, but it's necessary. So in the next year, if you experience pain implementing this change, please take 2 aspirin and call Mark in the morning. Thank you very much.
Thank Thank you, Dalibor. Are there any questions for Dr. Slavik, who's done an extraordinary job as president this year? Then on behalf of the Representative Assembly, I'd like to sincerely thank you for a job well done.
Thank you very much, Joe.